1. Has this ever happened to you? You're walking around doing your daily activities and all of a sudden you catch a cramp in the back of your leg. You rub it vigorously and no matter what you do, it will not go away. Finally, you sit down, giving up, and you realize that the pain has started to subside. How about the fact that your feet swell at the end of the day, even though you wear comfortable shoes and appropriate clothing? Are you short of breath from mild to moderate exercise? Now I know this sounds like an infomercial, but my friends, I want you to know that these are just a few signs that you may suffer from a cardiovascular disorder. Now we all know that the cardiovascular system is comprised of your heart, lungs, veins, arteries, and lymph nodes. It's the body's means for transporting specialized cells, oxygen, or nutrients to your visceral organs and tissues. The vascular system is made up of pathways that range in size from vessels likened to superhighways, to interstates, to main streets, all the way down to tiny and seemingly insignificant little vessels, something like maybe a county road. However, even the smallest little alleyway can make a tremendous difference in your overall cardiovascular health. Now, as a certified wound care nurse, I've worked closely with vascular surgeons, endocrinologists, cardiologists, and plastic surgeons even. At UCLA, I saw hundreds of vascular malfunctions that were not easy to fix, and some of them could have been prevented. So today I'm just going to give a very general overview about what vascular disease is, some common signs and symptoms, and how to prevent it. So let's begin by answering the most important question, and that is, what exactly is cardiovascular disease? Now, vascular disease, in a general definition, is the disruption of normal blood flow in any direction. In sclerotherapy and vein therapy, Robert and Margaret Weiss described peripheral vascular disease as one of the common vascular elements, and is loosely defined as the inability of the vessels below the heart to push blood back up to the heart. For the purpose of this speech, we'll focus primarily on the venous type of peripheral vascular disease. So what are the signs? One sign that someone might be suffering is what we talked about earlier, and that's the intermittent claudication, or the pain in the back of your legs that happens while you're walking and usually subsides when you're at rest. Swelling in the lower legs, ankles, or feet, varicose veins, thickening and discoloration of the skin around the ankles and your feet, throbbing, aching, heavy feeling legs, relentlessly dry, itching legs, and unfortunately, wounds. The venous type of wounds usually happens at the lateral aspect of your lower leg. That means the outer part of your lower leg. The Wound Care Education Institute encourages all of us to be on the lookout for dry, scaly skin that presents with reoccurring wounds. That person, more than likely, has a vascular disease and needs to see their doctor as soon as possible. Now let's talk about some of the main causes of venous insufficiency. First things first, the valves in your lower legs have weakened and they're unable to do their job. If you become obese or even pregnant, that could cause venous insufficiency as well. Trauma or injury to a vessel. And in this case, the vessel is damaged and it builds up scar tissue. The scar tissue impedes the vessel from doing what it's supposed to do. Diabetes. Diabetes causes neuropathy, which essentially retards the arteries. This is also called vascular dementia. Hypertension. And simply put, if your vessels are working overtime for a long time, they basically just give up. inactivity or sitting for prolonged periods, and most importantly, smoking. Smoking causes a hardening of the vessels and prevents them from expanding and contracting the way they're supposed to. This is because they build up a plaque inside of the vessel, and that plaque is called atherosclerosis, and it leads to a very slow and painful vascular deterioration. So finally, the answers to what I know you want to hear is, how do I prevent vascular disease? Well, if you have a family history of such things as heart disease, hypertension, or diabetes, you're already at risk. You must then focus on doing the opposite of all of the things I just listed. And most importantly, don't smoke. Stay active. Avoid becoming overweight. Maintain a healthy lifestyle, healthy diet, and exercise. And, try to do right. Treatment varies based on the severity of your condition and the number of contributing factors. So, if you think you're at risk, you really should go and talk to your doctor. In one of my favorite textbooks, simply titled Peripheral Arterial Disease, I learned that 55% of venous cases involve women, which is more than men. Usually these women are somewhere between the age of 50 and 65, but the disease itself can start at any age. It can start at age 10, it can start at birth. So take care of yourself. And if you have a parent or a grandparent who suffers from cardiovascular disease, remember, one day that could be you. Thank you.